My name is Jacqueline, and I'm a physiotherapist, and one of my specialties as a physiotherapist is in male pelvic floor. So the pelvic floor is a bunch of soft tissue, mainly muscles in the bottom of the abdominal cavity. It helps support your low back and your hips and your internal organs. So it's a collection of dynamic tissue that helps to kind of keep the bottom of your pelvis or the bottom of your abdominal cavity stable and your innards inside. The pelvic floor is really important for sexual health, as well as voiding. So nutrition or bowel movement, a lot of what happens dynamically is in the, well, I wouldn't say is in the pelvic floor, but the pelvic floor helps it. Pelvic floor dysfunction in males can range from teenagers to older adults, so there is a wide range. There is an increased risk as you get older, just because with males, typically the prostate can affect the pelvic floor, can help, or it can affect nutrition, so peeing. Some signs that you might need a pelvic floor physio with nutrition or peeing is that if you're having trouble starting your urine stream or stopping your urine stream, or it's interrupted, or post-nutrition dribbling. And so you go to the washroom, 5 minutes later, you notice you're dribbling a little bit. Some signs from a bowel perspective that you might need pelvic floor is if you are having accidents, so you're having incontinence where you're not making it to the bathroom on time. Some other issues too is if you're having constipation, that's chronic or even just kind of acutely just started, it might mean that you need to see a pelvic floor therapist, as well as loose stool. So you're having more diarrhea. Sometimes when you have any inflammation in the bowels, that can affect your pelvic floor. It can make you weaker, or the pelvic floor might be driving some of the constipation or some of the diarrhea. So regardless, you likely need treatment. Some causes of pelvic floor dysfunction, you can do everything right and it still happens. And so sometimes when people have a history of trauma to their sacrum, their coccyx, or their low back, or they have chronic low back pain, that's often associated with a weakening of the pelvic floor and you just never know it. And then the physios that you usually go to, they can't get internal unless you're specialized in pelvic floor. And so they might not know that it's happening. And so, so previous trauma, any hip pain or hip arthritis can be associated with male pelvic floor, prostate issues as well. People who sit for a long time. So if you sit for a long time or use a computer and you're sitting with it on your lap, that can also be associated with pelvic floor issues as well in males. Initially, we do have to do an internal assessment. So we do in males a digital rectal exam to kind of figure out how strong you are, what your endurance is like. Can you turn it on and off quite quickly? What's your relaxation like? What's your tension like? And so we do an internal assessment and kind of assess the quality of the tissue. And then based on assessment, it kind of guides our treatment. If you're too tight, we try and give you relaxation techniques. We can also do internal massage as well on it. We can mobilize the coccyx as well internally and see if that's moving well or not moving well. And then it is a lot of behavioral change too. So whether you need to increase your water intake or increase your fiber, or have more of a bladder or a bowel diary, or be more active and sit less. So a lot of times it is behavioral change, and then also education and exercise. At Calgary Core Physio, your privacy and confidentiality is really important to us. And so we never talk about any of your treatment or anything about you outside the room. It is a bit soundproofed, and we always talk in here and never out in the open. And then, we try and reassure you that this is, it's part of your body and it is kind of a taboo subject, but it is muscles, soft tissue, joints. So it's just like your elbow is just in a different spot of your body. And so we try and reassure people that they're in control. And if you're ever uncomfortable or have any questions during the assessment or uncomfortable with the internal exam, you can always take away your consent. You can always keep an open line of communication, say, hey, you're uncomfortable, we need to stop. Sexual dysfunction is quite common with pelvic floor dysfunction. So if you're having trouble with ejaculation or erection or having painful sex, that might be a really big sign that you do need to come see us for some pelvic floor assessment and treatment. In Alberta and across Canada, pelvic floor physiotherapy is a restricted act, which means physiotherapists who do get the designation have extensive postgraduate training after they've got their physiotherapy degree to actually do this on people. And so when you see a male pelvic floor therapist, you just know they've had extensive training for the specific issue and they're licensed in Canada to do it.